Now let's take a closer look at hand hygiene. It's been deemed that hand hygiene is the most important infection control technique. We need to make sure we disinfect our hands whenever they're visibly dirty or contaminated, and definitely before having contact with patients, putting on gloves, inserting invasive devices, manipulating any invasive device, and after having contact with a patient's skin, having contact with bodily fluids or excretions, non-intact skin, wound dressings, and contaminated items. And lastly, when we remove our gloves. Now let's look specifically at how to practice proper hand hygiene. It's been found that actually alcohol-based hand rubs, whether they're a foam or a gel, kill germs more effectively and more quickly than hand washing with soap and water. They're also, when combined with an aloe or some type of skin protectant, are less damaging to the skin. It's a preferred method unless you can see visible, dirty, some kind of contamination on the hands. When we do this, we're going to apply the recommended amount of the alcohol gel onto the hands, and then we're going to rub it over the full surface of the hands, into the crevices, around the nail beds, the fingertips, making sure we're getting full coverage of the hands. And we're going to continue to rub these for no less than 20 seconds, but especially until it's dry. We're not going to use anything to actually dry them. We're just going to continue to rub it, get it all over the surfaces of the skin, in any little area that you think, in between the fingers, around the thumbs, in the crevices, until it's actually air dry. Remember that we're going to rub on the tops of the hands as well. Sometimes we can get into a habit of just doing the surface, but making sure we get into the nail beds, the cuticles, the fingertips, the surfaces of the hand on the top and the bottom, all around. Now, if we see that we have obvious visual contamination on the hands, that's when we're going to have to move to the actual soap and running water method of cleaning our hands. So if we have contamination on our hands and it's visible, then we need to use hand soap and running water to decontaminate with. If you have the ability to use a sink that you can activate with your foot or with a knee bar, that's obviously the best way to go, but in this case we don't. So we're going to turn our water on, and then we're going to wet our hands. So we're going to go ahead and wet our hands, take off any watches or contaminated jewelry that will need to be decontaminated as well. And then if you can't take off like your wedding ring or another piece of jewelry, then you're just going to clean around that and underneath it. Once our hands are thoroughly wet, we're going to go ahead and get soap, an adequate amount in the palm of your hand, and then we begin to rub our hands. As we rub our hands, we want to make sure that we're applying the soap to the top surfaces of our hands, around the wrists, underneath the jewelry, around the jewelry, in between the fingers, paying special attention to crevices, wrinkles, nail beds, cuticles, in between the fingers. As we wash our hands, we're going to make sure to do this for no less than 20 seconds. And in fact, even some studies and recommendations are saying to go 40 to 60 seconds with vigorous scrubbing and washing of the hands and the fingernails and the beds. Once we've washed that for the recommended amount of time, we're going to go ahead and rinse the soap off our hands. I like to watch everywhere else on my arms, making sure, like with a short sleeve shirt, that I don't have any other spackle or spray or anything else on my forearms or on my elbows or areas that I may have missed. This is also a good time to double check to make sure we didn't get any punctures from sharp objects. And then after we're done washing our hands and rinsing them per the recommendations, we're going to move over to the hand towel. Now again, there are these different devices nowadays that are motion sensitive. And if that's the case, of course, we're not going to touch anything that we don't have to touch. But in this case, it is lever activated. So we're going to go ahead and get an adequate amount of paper towel. We're going to thoroughly dry our hands and our forearms or any areas that we've washed. And then we're also going to use this same paper towel or towel to reach over and turn off the sink. And now with the paper towel, we're simply going to turn off the faucet and then throw the hand towel away in the trash receptacle. If there's any contamination around the sink, again, that's going to get back to more of the work practice and the engineering controls, where we should be regularly decontaminating those surfaces anyways, along with watches or other contaminated devices that need to be cleaned up as well, following the regulatory protocol.